Hello, it's Dr. David Green, CEO of the Florida Pain Network. Today's topic is an overview of medial branch blocks. Back and neck pain affect 90% of Americans at some point in time. Back pain is the second most common reason people see a doctor, just behind the common cold. It's the leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful. The cost of back and neck pain in the U.S. exceeds $100 billion a year. The intervertebral disc is the source of back pain 40% of the time. The facet joints cause back pain about 45% of the time. Thumbnail-sized joints on either side of the spine are the facet joints. They're here, 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 here. They're small, but they can be a huge source of pain if they get arthritic. They do have cartilage. They are prone to arthritis, and they're just like the hip and knee. If as the cartilage degrades, they can become very painful. Now, diagnosing the source of one's pain in the back can be very difficult. A history and physical exam can help. Imaging studies can be helpful, but not definitive. So here you see a CAT scan of a slice where you have these facet joints, which look great. Nice joint space, no overgrowth of bone. And here you have a lot of irregularity in the joint surfaces, a bony overgrowth. You can see here and here with bone spurs. So interestingly enough, this may have no pain whatsoever. It may just be in something you see on the CAT scan. Now, the medial branches come off of the actual nerve roots. Here's a nerve root. This is a medial nerve branch. And there's all these little endings here. All right, you see how they go up and they go down, but they supply, this is a joint capsule, a facet joint. So you have nerve endings coming up, nerve endings coming down. That's how the joint feels pain. These nerve endings have nothing to do with motor function. It's all sensory, okay? Now, when you do a medial branch block, it's performed for two reasons. One is diagnostic, to see if in fact this joint is the source of one's pain, and the other is therapeutic. This injection of numbing medicine and steroid around these joints and the medial nerves can give months of pain relief. Typically, modern pain doctors will use image guidance with either fluoroscopy, which is a real-time form of x-ray, or ultrasound. Numbing medicine is used, plus or minus some steroid. This is an outpatient procedure. It takes under 20 minutes. You really don't need IV sedation, just some numbing medicine around the skin and in the soft tissues down to that area. Now, it does help pain doctors figure out if the joint is the source of the pain. If the injections work well and then wear off after a few weeks to a few months, it can either be repeated or move on to a radiofrequency ablation, which can be performed for long-term pain relief. So studies show the average pain relief from a medial branch block alone is over 3 months. It works well in over 85% of patients, and if you do a repeat, it works just as well. Here's a radiofrequency ablation procedure where you put the catheter in and you heat up this area and deaden these nerves above and nerves below, and that can provide pain relief anywhere from 6 to 24 months, which is an amazing amount of time for relief, and that's about 80 to 85% of people as well. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state in the network accepting over 50 insurances and providing over 25 different treatment options with the board-certified, award-winning doctors. Visit us online today at painmanagementtampa.com for treatment in the Tampa area, and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.